Hello, I am Tu Kim Lam. Welcome to the Medical News Show from Washington, D.C. In the last edition of the Medical News, we talk about the causes, symptoms, and the methods of diagnosis of asthma. In this edition of the Medical News, we will talk about treatments and the newest medication for asthma. Here with us today is Dr. Tran, who is currently practicing internal medicine in Falls Church, Virginia. He will share with us about the treatments and the latest medication for asthma. Welcome to our Medical News Show, Dr. Tran.
Hello and welcome to our shows, and hello, Mrs. Lam.
Dr. Tran, today we are going to continue our conversation on asthma. First of all, before we go into the detail of the treatments, can you please tell our audience again about the common risk factors that cause asthma?
I think the basic understandings of the asthma is, number one, the inflammations of the airways, meaning the bronchi. And secondly, the bronchoconstrictions, mean the narrowing of the airways causing by the constrictions of the bronchi. So the two components makes the patient become very short of breath, either acutely or chronically. So this is basic understanding about the disease called asthma. But what triggers asthma usually rely on two factors. Number one, the allergy, and number two is the gene related to the family. So for the allergy, I think we have multiple allergens in the air, at home, and everywhere. So we need to be careful about that, because that the trigger factors that bring about the acute exacerbation of asthma. So these are the basic concepts we need to remember to apply for the treatment as well.
Sir, can you tell us how many types of treatments are for asthma?
The treatment is so complex, and I think it depends on the physician who's supposed to treat the patient. But to be simple, I think we have two approaches. Number one is to deal with acute asthma and to deal with the chronic asthma. Acute means we try to resolve the short breath of the patient in acute phase. And chronic phase means we have to deal with that and to prevent the recurrence of the asthma attack. So now most of the medication we use right now, including the oral medications, very important is inhaler. We call inhaler, or MDI, is metered dose inhaler. And if this doesn't work, then we have to use nebulizer to bring the medication to the machine to have people cannot take a deep breath, or especially children. They can get the medication to resolve the short breath. And finally, the injection, the use for severe cases.
Sir, the first medication you talked about was the oral one. Can you tell us about this oral medication and what are the newest kind for this?
The oral medication we have, the first one, the prednisone, has been the oldest medications in the market, still very effective, very cheap, and still using nowadays all over the world. Because the prednisone will decrease the inflammation of the airways. That's what happened. They working very well on most of the patients. But the problem with that is because the long-term use prednisone may trigger some side effects like retention of waters, maybe trigger a little bit high sugars in the body, or maybe affecting the bone as well if we're using year and year with this medication. Secondly, the telfilin. Telfilin is called bronchodilators. This means is to relieve the constrictions of the airways. The theater has been using for maybe 4 decades in around the world, but nowadays only using mostly in the developing country. But in the United States, we use less and less because of the side effect, and really this medication not very effective to deal with the severe cases of asthma. Now, thirdly, we have more new medication called leukotriene modifier. Leukotriene is a chemical released by the allergic reaction in the airways in the lungs. When we target these, try to modify the leukotriene, and we're able to suppress the reaction and relieve some of the acute phase of the allergic reaction of the bronchial asthma. And the name of these medications, very popular, is Singulair, Arcolate, and Zyflo. But the most commonly used nowadays is just Singulair. And lastly, we have cromolyn sodium. This is a medication to target the mast cells. Mast cells are one of the cells in the body deal with allergy. So when we use to decrease the action of the mast cell, we decrease the level of allergic reaction, trigger the asthma. But nowadays we don't use much this medication because it's not so effective.
So let's talk about the importance of the pump or the inhaler for asthma. Would you please tell us more about how to use the inhaler properly, because very important, and are there any new pump medications that are more effective?
I think this is a very good question for the physicians and for the patient, because inhalers is very important nowadays, because we try to avoid using oral medication because of the long-term side effect. But the inhaler, we have two types: short-term acting. They call short-term effectiveness or short-acting beta agonist. The very common brand name is Proventil, Ventolin, and etc. The second medication is also very important, Atrovan or anticholinergic. This medication acting to decrease the action of the nerve from the central nervous system, affecting causing the constrictions of the airways. So these are the two short-acting and very popular because the patient needs to use that at needed, every 4 to 6 hours, because the medication won't last more than 4 hours. So they have to use many times a day. The second medication called long-term effectiveness or long-acting medication, nebulizer, and like salbutamol and formoterol, because the medication work longer and have more effectiveness in long term, up to 12 hours. So patient only use about every 12 hours, twice a day. And lastly, the medication very important is working to decrease inflammation of the airways. We call a corticosteroid inhaler. This is very important to play a role in the treatment because we have to use both ways to deal with the asthma attack. Now, nowadays, people use a combination, and we have the market, the combination of the topical steroid and the long-acting bronchodilator. So we have the Advair, we have Symbicort, and the most recently in 2011, we have the newest medication called Dulera. This is the newest formation that we have in terms of the nebulizer. Now, if you look at this on the screen, you can see how we use it correctly, the inhaler, because if you don't use correctly, you cannot get the medication into the airways. That means it's not really effective. Now, if you look at the inhaler, the cap, the medicine, and to cover. Now, before you use, you have to test if you still have the medicine inside. And in order to get the medicine into the airway, you have to open up the airways by putting into your mouth and close it and suck in. At the same time, press to get the medication get inside. So look at this one. Close, suck in, and press. Just one inhale. Wait until exhale, and you can do it 3 times. They call 3 puffs, and that's the best way. We cannot just open the mouth and put the medicine inside because the medication will come out. If you look at that, you can see this is the incorrect way. So we cannot do it. So if you do it correctly, you can see the medication is very effective right away in about 4 or 5 minutes. If you cannot do it, then we have to use the nebulizer. That the machine that provide the medication to the small tip. You can see on the pictures on the screen. You can see for children and for adults cannot using inhaler, we have to use a machine called nebulizer treatment.
So let's talk about the last kind of medication is the injection. How many types of injection medicine, and which one is the newest one that's on the market?
Right now, we have only 2 different types of medication, injectable, and the first one is corticosteroids. Been using for, I think it's for so long, and but still very effective. We can use IV. We can go to the IV fluid, or we go directly and intramuscularly, and to decrease the inflammation of the airways. It's still very popular right now. Most hospitals are using for to treat acute phase of the asthma. The second one is the newest one called Xolair. Xolair has been approved quite some time ago, but the most recently is the National Institute of Health. After studies this medication, they approved this medication using to treat asthma in the form of the injection subcutaneously. The action of this medication is to try to block the immunoglobulin E. That's the byproduct of the I think is from the allergic reaction, and the body try to protect again the reaction by producing immunoglobulin E. The immunoglobulin E will get to the receptor in the mast cell, and the mast cell will release the chemical. When using this medication, you block the immunoglobulin E, prevent them from hook up to the receptor. Therefore, the reaction will be much less, and the reaction causing by the allergy will be less and won't trigger any more acute attack on the asthma. So Xolair right now we're using once a month subcutaneously, or for people only over 12 years old. Has been approved by the FDA.
Dr. Tran, there are so many types of asthma. How do you know which medication or which treatment that we use? And also, can these medication cure asthma completely?
To answer the question, really, we don't have any medication to cure the asthma. The reason is so simple, because we have to deal with the allergy. And the allergy is really multiple allergen from inside and outdoor as well. So therefore, it's very difficult to control the amount of allergen that the patient is exposed to. And secondly, it's because it relates to some form of gene and family related. And therefore, really, right now we don't have any medication that can really say cure the asthma. So we have to deal with multiple issues in asthma. To give medication, to control the allergen, and using to prevent the recurrence of the asthma attack.
Dr. Tran, we have heard that other alternative methods such as yoga or practice breathing, acupuncture, or herbal medicines. What do you think of these treatment, and can these methods help the asthma?
It's difficult for me to comment about these alternative treatment nowadays. We're using very popular in the market: acupuncture, herbal medicine, yoga, meditations. I think when people they cannot find a cure for asthma, they're looking for alternative treatment. It's very common nowadays. But the only thing is because the agency that can announce some kind of guideline, and the National Institute of Health really don't say anything about these things, and they report that we need to get more information, more studies on the alternative treatment before we can apply to the daily practice for a physician. So until then, I think we have to wait until we have enough information about the alternative treatment for asthma.
So before we go, would you please tell us how to prevent the asthma?
The prevention is very important, because I think it's either to block the allergy. It's difficult sometimes, but right now with the technology, with the blood test and with the skin test, we can detect most of the allergen. And in order to deal with the allergen, the only approach is sometimes we have to use giving the injection called desensitization. Desensitization means using small amount of allergen to inject to the body, so the body can react slowly and get used to it and cope with that. So the reactions will be less and less when the patient exposed to the allergy. And that's the first thing I think we have to do. And then changing the environment, because most people either at work, they're exposed to something, dust or chemicals, or at home, they have to deal with mold, carpet, dust mite, and especially for the Asian group, they have to deal with the cockroaches dropping and things, all kind of things in the house, including furniture, everything. So I think that's the second most important, that we need to remember, changing the environment, especially at home. Now, then we have using medication regularly to prevent the recurrence of asthma attack. And finally, if you already have asthma, please stop smoking, because smoking will trigger more and make the asthma more severe and causing more complication in the future.
Dr. Tran, that is all the time we have for medical news today. Thank you for joining us, sir.
Thank you for watching our show today, and again, one more time, thank you, Mrs. Lam.
Thank you, sir. That was Dr. Sang Tran, who just shared with us the information on treatments and the newest medication for asthma. We hope that the information provided by Dr. Tran has shed more light on this disease. That is all the time we have for the edition of Medical News. Thanks for watching. I am Tu Kim Lam. We'll see you next time on the Medical News.